Good afternoon, good morning, good evening, wherever you are. This is the first, we are excited. This is the first iteration of the Public Health Jawn, Public Health Gems podcast. Here we are just really cultivating a space where we are talking about racial equity, health equity through a social determinants of health lens. So that is everything top to bottom. We are just committed to this big picture of improving community and advancing community health. So we are excited to have our first episode today where we'll get into many different topics throughout our journey during this podcast. You'll hear a lot on the maternal health side because that is my background, that's my specialty. But we'll hear a lot of different ways that we can impact health throughout the lifespan as we think about all walks of life. So let's talk about why we are here today. So for our first episode of the Public Health Jawn, Public Health Gems podcast, we'll be talking about minority mental health. This month in July, it is Minority Mental Health Month. And this week, we're actually kind of fading out to the end of the week and month, but this week is Black Maternal Mental Health Week. And so we know that in the United States that maternal mental health for all races, for all stages, is at a state of crisis where a lot of folks are facing a lot of different issues and challenges. But for Black individuals in particular, we know that 1 in 7 women and birthing people throughout their pregnancy and postpartum stages after pregnancy are facing issues around mental health. And we know that that can also lead into these issues that impact maternal mortality. So we have an exciting guest speaker today to join us, an expert in her field. We have Emera Dancy. Emera is a perinatal mood specialist. I'm going to say that again, a perinatal mood specialist. She is a graduate of Georgia State University over down in Georgia, Atlanta, that is, where she received her Bachelor's of Science in Psychology. And she is also a master's degree level social worker. That's an MSW for those who don't know, from the big R up in New Jersey, Rutgers. And she's my sister. So I get to cut up with my sister today on this first episode, on this first iteration. And it's going to be a good time. So, Emera, I'm going to turn the mic over to you. If you could just tell us a little bit about how you got to this stage of social work and public health. I keep bringing you back into the public health realm and side. But how did you get into this work? And what are some of those pivotal moments that really had you think more about protecting Black women and really elevating Black voices? And how do you do that through your work right now?
I love my public health workers. So, we got to shout y'all out all the time because it is really a team effort with all of this. I got into the maternal mental health field, that portion of mental health and things like that, kind of stumbled upon it, honestly. I kind of fell into it. It's always been a passion of mine. Passions of mine have always included my identities. So anything that I fall into, I hold a lot of marginalized identities. So trying to help other people who also have marginalized identities has always been a big thing for me. And leaving grad school, I didn't really know what exactly I wanted to do. I just, like I said, those marginalized identities are things I really want to impact. So I tried it out and I really enjoyed it. I myself want to be a parent one day, and I understand how intense of an experience it can be and how little there really is for mothers in general. But then when we take it a step further and look at it from an intersectional lens, we can see that for Black people, there's a lot less information for these types of things. So specifically, always trying to get down to the most marginalized and trying to pull the most marginalized up in every situation, in every identity group, and every cultural group is really what I'm passionate about. So it lives here right now, but it doesn't just exist here. It exists in so many different facets for me. But right now it is Black maternal mental health and trying to make sure that I have a good impact on our community and trying to be a part of improving those rates, and trying to make sure that we get out of this state of crisis. And part of it is mental health in and of itself. So it's really important.
Absolutely. Super important. And just going back for a second, thank you again for just sharing your time and your expertise with us here today at Public Health Gems. We're so excited to jump into the conversation. It's extremely timeful, we know, for birthing people, for parents, for partners, for fathers, for everybody on all sides. So can you tell us, just to get us started and to get us grounded into the conversation, how do you define maternal mental health? And what type of support is out there for birthing people before, during, and after pregnancy?
So I define it kind of similarly to the World Health Organization, WHO, we love WHO, which is a mother or birthing person's ability to participate and realize her own um, abilities to take care of her children and to take care of her household and to be a part of her community and being able to do those things in a way that is fruitful and productive to her under her definitions or their definitions. So this kind of like idea of everybody has a baseline. I always have to remind people that everybody has a baseline. Every person has a baseline for their mental health and how they typically feel on the inside. And that's being able to make sure that whoever's giving birth is able to return to that state of their baseline and being able to function in society in a way that reflects that and reflects what they are most comfortable with in their lives. I think that it really is a person-to-person thing. Sometimes in the mental health field in general, we can get very attached to the outcome looking exactly the way that statistically we would like it to look, but not everybody's baseline is going to be the same based off of different socioeconomic things, different just mental health issues. Somebody who has very intense mental health issues might not have the same maternal mental health as someone who doesn't have a lot of mental health issues. So it really just depends on the person, but it really is just trying to adhere to that definition of the personability of being able to participate in her family, being able to participate in her greater community, and just being able to have confidence that she's able to do the things that she's supposed to do to take care of the things that she has to take care of by having the responsibility of having a child.
Wow. Yeah, that speaks volume. And a couple words that stood out to me as you were going through and just sharing that great definition is it's getting back to that comfort level, like you mentioned, the baseline, that confidence, really words that really stand out to me because a lot of times we could be lacking these pieces and parts, maybe not even realizing it and self-realizing it within ourselves. And so it's so great to have professionals like yourself and many others out there that are just supporting moms all the way and birthing people to make sure that we have all the support and all that we need. And I oftentimes call that our tribe. So we thank you for being a part of that important tribe.
Absolutely.
That second part of the question, we're thinking about support that's out there. We know that you are one of those great pieces of support for a lot of structures, a lot of folks out there. Can you talk about more of what type of supports are available to women and birthing people before, during, and after pregnancy?
So as far as resources go, it depends state to state, of course. Luckily here in New Jersey, and as far as like the Philadelphia area goes, we have a ton of different resources that are available to moms and birthing people before, during, and after the birth process. So as far as that goes, specific to the work that I do in the state of New Jersey, we have different programs in place in each portion of the state. So northern, central, and southern, it's all different depending on where you live and the different county that you're in. There will be different resources based off of that. But each hospital has their own list of resources that is very well put together, very good, robust list in New Jersey, at least. When we talk about other states, though, there is a big disparity in a lot of other states, as we know when we look at the different statistics around birth and things like that. Those numbers tend to reflect the amount of resources that are available for maternal mental health as well. So within other places, I don't know how much is really available, but I do know in the state of New Jersey and, like I said, the Philadelphia area, that within each medical system, there is a lot of robust pieces of resources that can be gathered from these different places. And then within the state of New Jersey specifically, we do have different legislation per like portion of the state, depending on where you live.
It's great information. Yeah. And we just, of course, encourage those by state to definitely check out those resources. And those who may not be birthers or not, a birthing person, mom, parent, those that are also called a tribe, your support people, your sister, your brother, your cousin, your neighbor. Also know the support resources around you as it relates to mental health, because we know that there's going to be somebody in our lifespan that is going to have a baby that will need some support at some point, and to have that list and to kind of be armed with that list already is just a really great tool and resource to have in your back pocket, so to speak.
Right.
So for your next question, before we get to the question, I'm going to read a quote from what I found from Black Mamas Matter from one of their briefs on the website, as it relates to Black maternal mental health. So it says here that Black women do not only face a higher chance of developing perinatal mood disorders than white women, but they are also less likely to receive treatment due to factors such as fear and stigma, involvement of child welfare services, financial barriers, and additionally, Black women experience stress and health disadvantages because of their interactions with the effects of racism, gender, class, and age. And so we know that to be true, and those are some of the points that you have listed out to us really in your introduction as well about marginalized populations. So our next question goes into, as we reflect on that quote from that brief from BMMA, and think about the maternal health for Black women, can you share some of the recommendations of reducing barriers and stigmas and disadvantages for Black women specifically? How can some of those stigmas that we find and some of those issues and challenges be reduced down for Black women so we can help to advance mental health?
Oh yeah. So I think that the first two things that I'm gonna say, I do realize are based in the amount of privilege that you have, definitely on a socioeconomic stance, of course. But I would say if you can get a doula, if you can get a midwife, do so. If that is within your financial ability, please do so. Especially a doula if you're going to be in the hospital giving birth as opposed to at home or a birthing center. I also encourage that people do their research, especially before getting pregnant, if possible, about what is available to you in your state, in the particular area that you live in, and if there's any type of Black mom communities. There's some online communities as well that I think are very useful. I'll list some at the end when we go over some more of those tangible resources. I think, though, that education portion and knowing what is available to you where you live, and if there isn't, seeking out an online community where you can get information and understand how to advocate for yourself. Social media and different facets like that are so useful for this because that's how we connect now. We connect so much online that if you can find that community and find some professionals online to follow that help you learn to advocate, I think that that's another thing. A big thing is also being able to involve as much of your community, like you said, that tribe as possible, being able to, have so many people standing, next to you and behind you and in front of you to make sure that you are protected and that you are getting the care that you need and that everything is going in a way that makes sense to you as a person who is giving birth. I think that is so, so important for us to really lean into those community portions of our lives to really be able to feel that protection around us and know that we have that type of community. It's very hard to do all of this. Like they said, it takes a village. And I believe that's even before baby gets here. I think that that is so important in and of itself. And I always say, advocate, advocate, advocate. I know that that's something that I've said already a bunch of times, but I think that learning the steps of how to advocate for yourself and how to make sure that you're, standing up for yourself and that your partner's standing up for you and, that village that you take into this experience is standing up for you. I think it's important that everybody learns the steps of advocacy and how to talk to these different professionals who might not otherwise take you as seriously or not see your issues as so much of an issue that they should be handling. I think that's really important as well, and maybe the most important thing, if nothing else.
I'm going to stay there for a minute. I'm going to go off the grid a bit with our questions, but
Off the grid.
yeah, we mentioned advocacy and definitely a big advocate of advocacy.
Right.
I know in the past I've co-developed some questions that moms could go to the doctors and what they should ask when they go to their doctors or their prenatal appointments, and also helping to co-develop these same type of questions, but for Black moms and Black birthing people. So staying on the advocacy piece for a little bit and just thinking about ways that Black parents could advocate for themselves, what are some other ways that you think that parents and Black birthing people can advocate for themselves in these type of mental health spaces?
I think that being able to make sure that you keep up with the relationship that you have with your medical professionals that you're seeing for your regular doctor's appointments. I think that building those relationships is a first step of advocacy and making sure that you're having these conversations with your doctor. I think also being able to, another part of education is being aware of what the symptoms look like, so that you can be very specific with what you're feeling. That way they know that you understand exactly what you're looking at. So if we're talking about something like postpartum depression, you want to know what those symptoms look like and what that feels like. Postpartum OCD, knowing what intrusive thoughts feel like and like what that looks like, so that you can describe things in a way that feels a little bit more almost tangible to the professionals that you're talking to. Being able to define your mental health for yourself and understanding how you want to feel is really important too. Understanding your baseline, going back to that, and understanding what you typically feel like, and being able to understand what you're feeling like now and comparing those two things and being able to really keep up with that is really important for that advocacy piece and being able to speak up for yourself, because I think that it's really hard to define some of these feelings if you don't know how you typically feel or how you would like to feel. Advocacy can be very hard in a racist system, because we all know that we live under racist systems that, make these things hard and obviously get us the statistics that we have. So I feel like the advocacy piece is really something that is going to be personal to the experience that you're having and the comfortability that you have with the medical professionals around you. And the onus shouldn't be all on you to do this work, but I think at the same time, it is really important that we have as much verbiage, as much language, as much self-awareness as we can going into these spaces. And that goes honestly for all portions of the medical field too, not just the birthing aspect, but everything. And I think that that's really important. Is just knowing how to properly define what you're looking at and what you're feeling on a day-to-day basis, so that you can get the help you need. And I think on that too, working early, I think that is really important before you start to feel super bad, or you assume that you might not go through a certain mental health experience when going through the birthing process. I think that it's important from the start to once again tap back into that education and be aware, so that way if you don't end up feeling like crap, that's amazing. You can go on with your life and you can know that you just have this information in case a friend needs it or a sister needs it or somebody like that. But you also know that if you do have the worst of the worst symptoms, that you have some education and that you've done some background work before even, getting to that point where your hormones are doing a lot of different changes and things like that. So overall, it's a lot of education and a lot of trying to, fortify yourself with the best knowledge that you have. But like I said, the onus isn't just on the person, obviously, that's on the medical professionals to actually care and do the things they're supposed to do. But at the same time, making sure that everything you can arm yourself with, you have a good arsenal of tools to be able to talk in a way that makes people understand exactly what you're kind of going through.
Absolutely. Yeah. Yeah. Definitely going back to that toolbox, and having the time to research and to know the signs and to be able to identify when this doesn't feel right and kind of put your finger on it is so important, and keep your finger on the pulse of that. And I'm saying the same thing I said earlier, fathers, partners, mom, dad, grandma, grandpa, whoever are our support people, friends, neighbor, also need to know about these
Everybody should be involved. Yeah.
critical signs. So it's definitely not just on, birth in person. It's for everybody to know. So thank you for sharing that in realm of advocacy. Oh yes, and please, if you can, we need a doula. We need midwives on board too. So thank you for sharing that too at the beginning. I thought that was really a gem that you dropped there for us.
Absolutely, because I think if that's something that you I will reiterate, if you can financially afford that, that takes a lot of the pressure off of you and everyone else in your family that isn't being paid to be there. It takes a lot of pressure off of everybody, because doulas, they get it done. They definitely get it done. I've seen a lot of work from doulas that have changed the experience for a lot of my Black mamas and the Black clients that I do talk to who have had doulas. That's their first thing. Anytime I ask, that's the first thing that they mention.
Yes, and I have to mention this too, because we're in the maternal health space, and for those who might be outside of the space or just not familiar, a doula is someone where she is going to be a part of that tribe. She's going to be your support person throughout pregnancy, even after pregnancy, and if you are a birthing person or a mother, unfortunately, if you do have a loss, there are also doulas to support you in loss as well. So really just being there to be an advocate, helping you to have some healthy tips as you're going through, really being respectful of the choices and the options that you have during your pregnancy and afterwards. They're not a medical professional by trade usually, but they are your support person and so important to the tribe. So that was a gem that you dropped, and definitely we'll leave some show notes about that afterwards. So before we get to end, because we're going to talk about resources, we're going to talk where to find you as well. But just anything out here that you want, moms and birthing people to know around mental health before we kind of get to our closing.
I think that my biggest thing, and this is what I tell all of my clients, is that your baby cannot be okay if you're not okay. It doesn't matter how hard you push yourself. It doesn't matter, what you do and what you try to do to avoid the situation. If you're feeling horrible, if your mental health is not lining up with where you were prior to giving birth after, a couple of weeks of feeling a little bit, down, those couple of weeks of baby blues, that's a typical experience that a lot of birthing people have, and it's uncomfortable, but it's good to know that that's something that is a little bit more typical. Once you get past the first 3 to 6 weeks and you're still feeling really, really bad, don't try to push, don't try to force, yourself to feel better. Take the steps, talk to your doctor. If your doctor's not someone that's comfortable for you to talk to, there's a lot of resources online to help find different practitioners and doctors that might be able to also help you and make you feel more comfortable. Another tip that I also have is, try to find a Black doctor if you can. I think that that's really important, to have somebody that at least sees you as you are and understands a little bit of the experience that you've had throughout life and throughout your birthing process. But I think that overall, you have to know that you are the best parent that your child could have. And that is a responsibility, meaning that you have to not only take care of that baby, that precious life, but you also have to take care of your precious life. Because just because you've been here longer doesn't mean your life is any less precious than the baby you just birthed. And that's the only way that that child can be okay, is if you are okay. So make sure that you prioritize that, because by prioritizing that, you are prioritizing baby. And I think that that is really, really a beautiful thing, is knowing that if you come first, baby also comes first. And I think that's awesome.
Absolutely. Yeah, birthing person, mom, they have to be at the top of the list, prioritize themselves. So thank you for sharing that. As we get ready to close out, if you want to drop any gems and share any mental health related resources, what are some of your resources? And we'll also include them in the show notes as well, but feel free to give us some resources. And if you could double up and tell us what are some resources for some fathers and partners too.
Okay, I gotcha. So one of my favorites, just as a baseline for anybody who's everybody, if you're pregnant, please check it out. It's Postpartum Support International, PSI. They have weekly groups that are 90 minutes. And I always tell people, get into a group if you are feeling like you can be social, if you're not typically, a little bit more introverted, if you're somebody who at least can sit and listen in a group, get in a group before you start feeling feelings that are very heavy for you, because it's a lot easier to integrate yourself into these free groups that are amazing and give you a sense of community with people. When you're feeling a little bit better than when you're feeling a little bit worse. Once you start to feel a little bit worse, a lot of people become disinterested in things like that. So I say that, get in there at least like once a month if you can, if that's something that's feasible for you. They are free through PSI. And they do run for 90 minutes and they are all virtual. So it's very accessible, thankfully. Another one that I have is Parent X Hood for all of my queer and same-sex parents. Parent X Hood is a community for Black queer parents who need community support for different things, from conception all the way until after birth, all different types of resources for all different types of families, families that look all different types of ways. And then, give me 1 second, I got another one. I just off the top of my head. We have the Dad Gang. I think that the Dad Gang is an awesome resource. That is one that I think is really cool. It's a way they promote Black fatherhood. They promote community within Black fatherhood. They promote different resources to build the bonds between Black fathers and their children. And I think that they're awesome. And they have a big following, an Instagram community. So I would check them out. EveryMotherCounts.org has a great resource hub for Black maternal mental health resources. So I would check them out too. That's EveryMotherCounts.org. And I think that's all I got off the top of my head, but I do have more for the show notes. Absolutely. I do have more for the show notes.
We're here for it. You are just dropping gems left and right. We are here for it. We'll leave it on our show notes on the website at publichealthjawn.com, and you'll also be able to find it on Instagram. Yes, because that's where we are. That's where we live.
We love Instagram.
We love it. We love a good IG. So we'll conclude today with those gems that you dropped. We want to thank you so much for just rolling out this red carpet for us on the very first iteration and episode of Public Health Jawn, Public Health Gems. Thank you for dropping your gems. Thank you for your valuable information, your time, and just providing insight. You do this on a daily for mothers, for birthing people, partners, families, and just thank you for also being a part of the Public Health Jawn community. So if folks want to connect with you, if they want to learn more, can you share a little bit of information of how they can connect with you?
Connect with me on LinkedIn. That's where I am my best self. I have not been on LinkedIn recently, but I will be going back on LinkedIn to do a whole lot of talking. I have a whole lot of thoughts in this brain. So I will be back on LinkedIn. You can find it by my name, I guess, Emera Dancy. I'll be on there. You'll see me. I'll have a picture. It's okay. But you can find me on LinkedIn, and I will also leave my email in the show notes if anybody wants to email me anything, any questions or anything like that. I love stuff like that. So I love a good brain pick. I'm not one that's anti-brain pick. So if you want to pick my brain, my brain's good for picking.
We're here for that. You were here. The brains are picking. We're here for the right picking of the brains. Once again, thank you so much to Emera Dancy. She has dropped some gems on us once again for this first episode.
Thank y'all for picking up the gems too.
Picking them up. We're picking them up. And it was just great. It's great information for all of us. Very digestible, very timely as always, as mental health is something that is always and should always be prioritized on top of the table. Everyone check us next month for our next podcast. Look forward to sharing that with you. But in the meantime, if you're looking for Public Health Jawn, if you're looking for community coaching or consulting, check us at publichealthjawn.com once again, or you can check us out on IG, Instagram at Public Health Jawn. We look forward to seeing you. If you have any questions, any thoughts from this episode, feel free to reach out. Like Emera said, we're here for the picking of the brain. So feel free to reach out to us. Thank you so much for tuning in, and we'll see you next time for the Public Health Gems podcast. Thank you. Bye-bye.